Welcome to Mom and Mind, where we dive into all aspects of perinatal mental health and wellness related to pregnancy, birth, loss, postpartum, and new parenthood. It's so much more than postpartum depression. We raise the volume on all of these topics in the hopes that someday everyone will have the support and info that they deserve before they need it. Please note this podcast is not a replacement for treatment by a professional or professional training. Welcome back. I'm your host, Dr. Kat. I've been really interested in expanding our understanding and our conversation around food and body image and eating disorders and how perinatal bodies change and how those changes affect our mood and our sense of self. And to that end, today, we are going to be talking a little bit more about eating disorders in the perinatal period. Dr. Linda Shanti McCabe is going to be sharing with us some of her experience in helping perinatal moms, what some of the common triggers are or factors that come up for moms with eating disorder histories, or some things to note about how, old behavior patterns might be coming back up during pregnancy or postpartum, and really some good ways to cope through this period of time. Dr. Linda Shanti is going to be sharing with us today. She is a licensed clinical psychologist in California and has worked in the field of eating disorder, chemical dependency, anxiety, depression, and codependency recovery since 1999. She's served in a therapist in a variety of settings for women and their families and now has a private practice in San Francisco. Her doctoral research focused on reimagining the body using expressive arts with women recovering from bulimia, anorexia, and binge eating. Dr. Linda has completed PSI's perinatal mood and anxiety components of care and has completed trainings in expressive arts therapy, soul collage, and trauma. Doing this work is her true labor of love. She knows the terrain of eating disorder recovery and new mommy boot camp because she has been there. She's recovered from an eating disorder herself 20 years ago, and she is a therapist that believes that you can't keep it unless you give it away, but you can't give it away unless you have it. She's going to tell us a little bit more about what that means. She has a new book coming out, The Recovery Mama Guide to Taking Care of Your Eating Disorder, Recovery During Pregnancy and Postpartum, and it's out this coming February 2019. And you can pre-order it now. We'll talk a little bit more about that too. I'm excited to share this conversation with you. Let's meet Linda. Welcome, Linda. Thank you so much for being with us.
Thanks for having me.
Well, I'm very happy to continue the discussion here on eating disorders in the perinatal period and anything else you have to share with us around body image during this time. I think it's such an important topic and, we don't hear enough about, and certainly I know your experience is that people don't talk enough about it either. So start there. Let us know what even are eating disorders in the perinatal period and what would you like us to know about them?
Well, I think the piece that often comes up for women, there's all kinds of scenarios here, but is that women that have been in recovery start kind of freaking out during pregnancy and postpartum. But then there's so much shame around, oh my God, am I relapsing? Or I thought I was over this body image thing. Or there's so much like perfectionism that they don't talk about it and then it gets worse and, then they're back in it. Mm-hmm. That's definitely one thing I see. Yeah. Plus the whole just culture of fat chat, within perinatal circles.
Can you say more about that? What is that?
Fat chat. Yeah.
Yeah.
It's, how much baby weight are you gaining and how much weight are you supposed to gain and how quickly are you supposed to lose the weight postpartum and all of that. And and then all the sort of subtext of what eating disorder professionals call diet culture or thinspiration or thin privilege or the thin myths around thinness, which means if you're thin, you're happy. If you're thin, you're better. If you're thin, you're more valid or more accomplished or, whatever is associated with thin, air quotes. And moms really struggle with this. And I think in particular around this myth, there's also this place I see with moms that are, have a level of conscientiousness, both personally and then from a kind of social justice perspective that they shouldn't be concerned about body image because it's a superficial, concern, but at the same time they are struggling with it. So again, it kind of keeps them from talking about it.
Wow, that's really fascinating. I mean, just hearing that, the way that you said that, I can really see how much that happens. Wow, there's just pressure in every direction.
Mm-hmm.
Talk about it, don't talk about it, accept yourself, but then secretly having all of these feelings and, that's quite a bit. It's like a complicated weave, complicated web of issues that are coming up just around body image and eating.
Yeah, which you don't have to have an eating disorder to be struggling with. Absolutely.
All right. Yeah. Actually, can you say more about that? What are the things you see moms kind of struggling with during the perinatal period related to body image, whether it's diagnosable as an eating disorder or not?
Well, I think the tough thing is that it's so kind of accepted that we are swimming in diet culture that, I was in mom's groups as a new mom, and that was like what you talked about. Like, have you lost their baby weight? Like, I'm trying to lose the baby weight. Oh, I can't fit into my jeans yet. And all of that. At this point, I had recovered from my own eating disorder. I was 13 years in recovery, and I had, 10 years of working in mental health and, yada, yada, yada. And I was like, I still had a hard time in those early months, like talking back to both internally and externally those messages, like within the moms groups. It's just so pervasive.
Yeah, right. It's just kind of woven into the culture.
It's woven into the culture, and then it masks all these other concerns then we don't address actually talking about, like how hard new motherhood is and how it like levels everyone, and even, people that were like super accomplished in other areas of their lives, and then they have a baby, and like especially those that struggle with perinatal mood disorders, right? That, that's not something that's easy to talk about, especially if you've been super accomplished prior to becoming a mom, and then you're just totally leveled. And how do you talk about that?
All right.
It's easier to talk about losing the baby weight.
Oh, right. I see what you're saying. It's not necessarily a superficial thing to talk about. It's just what's socially acceptable to talk about.
Right. It masks the underlying tough stuff.
Right. But in and of itself, it's pretty tough.
Yeah, it's also tough. Right. Yeah, it's also, it's tough postpartum. I remember that, having my belly feel like a deflated waterbed and being like, I should love this. I don't love this.
Oh, right. And also, I appreciate what you're saying, that you don't necessarily have to have a diagnosed eating disorder to be affected by body image or eating a related stress. There's such a huge change that the body's going through anyways. I imagine it can bring up all kinds of stuff regardless of a diagnosis or not.
Absolutely. Even looking at, the hormonal factors, like everything that happens during pregnancy, but especially postpartum, around hormone shifts and sleep changes, those in and of themselves, before you even add this like huge steep learning curve of new motherhood, but just the hormonal shifts and the lack of sleep set people up for having difficulties with mood. And when there's difficulties with mood, there's often difficulties with food.
Right. Well, of course. When you say it like that, it's so, yeah, of course, it's such a simple connection, but yeah, it absolutely is. I sometimes see too that the more tired people are, the more they end up feeling hungry or needing to eat, in part just to keep themselves going. Like their fuel tank from sleep is low, so they might feel more hungry or be eating in a different way because they're so tired.
Absolutely. And I should memorize this. I'm sorry, I don't remember it. I still have mommy brain 7.5 years out.
Hey, no, I'm with you.
Yeah. I work with, a lot with dietitians as part of, treatment teams. And they tell me about that. There is a link with your ability to accurately read your appetite cues and your hunger and satiety cues that gets disrupted with not enough sleep or with frequent awakening.
Oh my gosh, that's every new mom.
Right? Exactly. So, I know so many recovery people, call them normies, like people that haven't had eating disorders. Oh. I know so many moms that like their eating and their appetite and their hunger and satiety cues and their body image are totally thrown off in new motherhood.
Mm-hmm. Yeah. This has to be everyone.
Mm-hmm. Mm-hmm. So then it's just the people with the history of an eating disorder get kind of thrown off because it's hard for them to hold it in a context of like, oh, this is just part of the terrain, and sort of like bring that kind of mindful self-compassion, common humanity piece. Instead, they go like, oh my God, I'm relapsing. Oh my God, you know, and then they go into it and they go into the shame and they go into the isolation and they go into hiding it and, you know, they go into, yeah.
I mean, okay, so that makes me think too, because that happens with depression and anxiety also. Some people who have a history of it and they're feeling those feelings again have that same sort of shame spirally feeling. But man, if you have both, whoa, that is a lot. So the history of an eating disorder and then having some of those feelings come up again in itself is a trigger, or, I mean, would you call it a trigger?
Yeah. So back to the food and mood connection.
Yeah.
So, you know, the stats like 1 in 7 or 1 in 5 more recently, you know, women struggle with perinatal mood disorder.
Yeah.
So eating disorders, it's about 1 in 10. That's like combining anorexia, bulimia, binge eating disorder, and eating disorder not otherwise specified, which is most of them, because usually there's like some restricting, some binging, some, you know, it's usually combination. Anyway, so if you take those 1 in 10 women that have the eating disorder, the stats differ, but it's like 80 to 90%. Like it's a high percentage of them have a mood disorder.
Yeah.
Because an eating disorder is often an undiagnosed mood disorder.
Right.
So
it's coping.
Right, exactly.
Maladaptive coping.
Exactly. So those are the women that, you know, heading into pregnancy and postpartum, they're at risk kind of on both fronts. Yeah.
Okay, so we're not paying enough attention, right? We're just not paying enough attention to this.
I guess so. Yeah. I mean, I think that there's a lot of, here's what I found as an eating disorder therapist that then became a new mom. Like, okay, no, as a person recovered from an eating disorder, then headed into motherhood, I was looking for resources personally, you know, before I even like became it professionally. You know, I was an eating disorder therapist, but I wanted to make sure I had my own support when I became pregnant and went into postpartum. So I was looking for those resources, and I think there are a lot of resources. It's just there's not a lot of bridges between the resources.
Right.
Perinatal mental health providers, and there's, you know, the lactation people and the doulas and midwives and OBGYNs, and then there's the eating disorder specialists and the eating disorder therapists and dietitians and blah, blah, blah. But there's not like the people that work with both. And so that's where I, like, once I had been through it personally, was like, oh, okay, I'm going to be one of those people. I'm going to be that, you know, bridge, that resource.
Wow, that's awesome. And I mean, I just find it so fascinating and also sort of empowering how many people get into this specialty and like double, triple specialize because of their own experience. And it really takes people like you who see the connection and see the gaps and do something about it. I mean, your own journey has ended up and is being a support for other people, which is just beautiful.
Thank you. Just like you. Yeah.
Thank you for that.
Yeah, that's most of us, right?
Yeah, it is most of us.
Yeah, we go, but once we get it, you know, you can't keep it unless you give it away.
Yes, I did want to follow up with you on that quote so that you can say a little bit more about it. So you believe that you can't keep it unless you give it away, but you can't give it away unless you have it. What does that mean to you?
That means that I can't do this work unless I've done the work and continue to do the work personally.
Right.
But I can't really, really what gives it meaning for me that sustains continuing to be of service is giving it away. You know, being that resource for others, you know, leaning back and, you know, reaching a hand back.
I love that. Thank you for sharing that. So if we can dive in a little bit more into your work and the book also that you've written, The Recovery Mama Guide to Taking Care of Your Eating Disorder, Recovery During Pregnancy and Postpartum. That's coming out February 2019, correct? Yeah. So if you can speak to, I guess, your experience as a therapist and also any resources in your book, what are some common triggers or factors that come up for moms with eating disorder histories that kind of lead down this path of stress again?
Sure, sure. Yeah. Well, we've touched on one already. A big one is body image.
Mm-hmm. So body changing, their body's changing.
Yes. So there's two things. Yeah, there's the literal, like your body literally changes a lot during pregnancy and postpartum, and then it doesn't necessarily go back to, what it was before pregnancy. And most women have some kind of grieving and new identity formation process around that. Mm-hmm. Or if they don't, they're swimming in diet culture trying to get back to their pre-baby body, which is not possible. So there's that. There's a couple studies that I love that kind of showed the difference between like someone that develops an eating disorder and someone that has some body image issues that doesn't have an eating disorder. And basically what the research shows, and this totally fits with my experience and the clients that I work with, is there's a perceptual and an attitudinal and then a cognitive like dimension of body image. There's kind of like, okay, I'm not going to say sizes or weights to not be triggering, but let's say you're a size da-da-da, right? Mm-hmm. And maybe you want to be a size da-da-da, right?
Yeah.
And you'll never be a size da-da-da. Right? Okay. So there's just that reality. And that's largely determined by genetics, by the way. That's not determined by there is some aspect of how you're eating. I mean, if you're binging, or restricting, then you're going to change your body, but it's going to be temporary because your body has a natural set point and it's mostly genetically determined. That's like a big lie that the diet industry is trying to, not let you know.
That right there is an entire episode in and of itself.
Right?
Oh my gosh.
Yeah. Right.
So we've been being literally fed lies about what we're supposed to look like. And okay.
Yep.
Right.
Yep.
Noted.
Yep.
Okay.
Yep. It's kind of like, I was going to use hair color analogy, but that's not the best one because you can change that. Right. But like those fruit shapes, like I hate those fruit shape analogies. Like
the body
is pear sized.
Oh, right.
Like, okay, but my body, I do have a somewhat thin body in terms of like the kind of natural spectrum of body types. And I only name that now because, of course, my body image critic would say, no, she doesn't. No, she doesn't. I name that because it's a really important social justice piece around weight stigma. So
say more.
Yeah, because I walk in the world with thin privilege, just like I walk in the world with a certain amount of privilege because I have whitish skin. And it's my job to be aware of that from a social justice standpoint, that I'm going to be treated different because we don't live in a health at every size, weight, neutral culture.
We absolutely do not.
Right.
I'm Dr. Kat, host of the Mom and Mind podcast, where we cover everything related to your mental wellness in pregnancy, loss, birth, and postpartum. It's more than just postpartum depression. I interview experts in the field, and we get to hear real stories of healing from courageous moms and dads. We know that you are not alone on this journey, and now you can know that too. Listen in to Mom and Mind wherever you listen to podcasts, on the Pod Network, or at momandmind.com. In terms of just being a person of color, there's a whole different set of stuff for that too, right?
You mean in terms of body image, or do you mean in terms of like lack of access to privilege kind of?
Well, both. I mean, I think we were talking a little bit about this before we started, how eating disorders largely are seen as like a white woman issue.
Oh, yes. Okay.
And how we're leaving out a whole lot of other people who may be having eating disorder or body image related stress out of the conversation and out of the realm of getting adequate support.
Yes. Okay. That is a great question. Okay. So no, eating disorders are not just for white women. I'd love to say they're like an exclusive, disorder, because who wants an eating disorder ever? But no, there are many factors that contribute to developing an eating disorder, and they are not limited to white women. I'll just give a little vignette with obviously disguising any confidentiality concerns, but this is how it shows up in terms of difficulty accessing treatment. Mm-hmm. And I'll speak to kind of both the client and the professional side in this. I've worked for a lot of different eating disorder treatment centers. I'm in private practice now, but in the past I've worked for lots of different ones. And this one, we had an African-American woman client, and we did a family group every week. And her mom literally would not come to family group because she said, that's a white girl disease. Mm-hmm. She would not come to family group. And it was tough because, so on the other side, I'll say another piece that was really, we tried on the staff side. There was another woman, she was Vietnamese, she was first generation, and her mom did not speak English. And we tried and tried and tried to find, we had no bilingual therapists on staff. We tried and tried and tried to get a translator and could not find one. So we did have her mom come in for a family session. But the challenge was, this is the challenge, because one of the dynamics that often happens with eating disorders is the daughter is the parentified child. Mm. Oftentimes, the daughter is kind of, not consciously, but has been taking care of her mom for her whole life.
This is across culture?
Well, this is a dynamic, this is a dynamic that I see cross-culturally.
Okay.
But one thing that showed up in treatment, which I felt horrible, because I saw it being reenacted, was, so this mom of the first generation Vietnamese woman came in for a family session, and the daughter was doing all the translating for her mom.
Yeah.
So she couldn't just get to be a client. It was awful. I could just see it happening in the session. And I was like,
hard.
This is our shortcoming on the treatment team.
Mm-hmm.
So I think it goes both ways. I think there's stigma on the side of clients coming into treatment. And I think there's work to be done on the provider side in terms of, cross-cultural competence.
Mm-hmm. Right. That makes a lot of sense. So I think that, every time I talk to someone, I'm like, oh my gosh, we should do an entire series on this. It's so complex. There are so many factors that go into any type of complication. I don't like that word, but that's what's coming up. Whether it's related to mental health, physical health, eating disorders, you name it. There are so many factors that go into, and it's so hard to capture all of that in, these 30, 40-minute conversations. But I really do appreciate you speaking to this kind of notion that eating disorders are for white women, because it does sound like from what you've said that a lot of other women are being left out of the conversation, or being left out of the support, or being left out of treatment. And we have a lot of work to do there.
Yes. And I'll add, in terms of inclusivity, so the myth, right, with eating disorders is eating disorders are for straight white adolescent women, right? That's kind of the myth. Those are the people that develop eating disorders. Like
straight white adolescents. Okay.
Right?
Yeah.
And people of all sexual orientations and genders and gender identities can develop eating disorders. Eating disorders, just like other issues people wrestle with, like mood disorders, for example, are often part of an attempt to work through a trauma, or if we want to put it sort of in psychological terms, and they're also a kind of a misplaced rite of passage.
Interesting.
So like, for example, sometimes when someone is trying to come out in the coming out process, that's when an eating disorder might develop, right? Those kinds of things. So they do see that, like an eating disorder can tend to develop during, and that makes sense with the myth around adolescence, right? Because that's a big rite of passage.
Yeah, that makes sense.
But also in midlife, in pregnancy and postpartum, in the coming out process, in loss of a loved one after a traumatic incident, etc.
Right. So thank you for speaking to that. And, as you said, having a child is a rite of passage as well, and can bring up a lot of things. And we took a slight an important bird walk from the factors and triggers.
Thank you.
That might
bringing you back,
bringing us back around. Some of the triggers that may, for somebody who's had an eating disorder history, you spoke to body changes happening. What else might people notice?
Yes. Well, let me say another thing about body image, and then I'll name some of the other factors. So the thing about body image that I took a bird walk around, never finishing, was that women with either the history or a current struggle with an eating disorder. So there's the thought about your body, and then there's the feelings about your body.
Yeah.
And, most people, at least in this diet culture, until we obliterate that, have some kind of awareness cognitively, and then a gap. Like they want to be this size, but they are this size. But their feelings about it, that's where the women with the history or current eating disorder have a huge gap. Have a huge gap. And how that shows up, for example, like postpartum, is that, let's say a woman without an eating disorder, postpartum, most women have some body image stuff postpartum. And they're, let's say they go back to work at 3 months or 6 months or whatever, whenever they go back to work, they might not be feeling great, but they're kind of like, they hold it in a context like, I had a baby. Like, I grew a human. Mm-hmm. My body's different,
Right.
And so they might not be thrilled about it, but they have some level of radical acceptance. A woman with a history of or currently struggling with an eating disorder, that's where she has trouble giving herself slack. And that's where it will take her like 9 months to a year to be able to leave the house because she hates her body so much. That's the difference.
Yeah.
That's the difference. They wait till like they're perfect, which doesn't exist. They want to be through the struggle before they talk about the struggle. And they don't realize that talking about the struggle is what gets them through the struggle.
Right. Right. Because I guess when you were saying that, I just thought, oh my gosh, that's a huge amount of shame to not be able to leave the house because of whatever, fear of judgment or the thought, self-judgment. That's incredibly paralyzing.
Yeah.
And so people, may not be talking about this at all.
Yeah. Yeah.
So hard.
And let me come back before I forget, because you were asking about triggers.
Yeah.
So body image, that's a big one.
Mm-hmm.
Relapse into a mood disorder, that's a big one.
Right.
Past abuse triggers, especially that come up around labor and delivery or breastfeeding. Lack of sleep. Food cravings, gestational diabetes, nausea related to pregnancy or, throwing up related to pregnancy, or increased hunger or difficulty with like regulating new hunger and satiety cues. Those can be really triggering because, let's say someone's been in recovery for a long time and then all of a sudden, like they're breastfeeding or something and they're famished all the time. It can feel like, oh my God, I'm binging again. Instead of like, no, I'm just really hungry because I'm breastfeeding. So I need all this extra food, no, it's okay. I'm not binging. I can trust this increased hunger level.
That's so hard.
Yeah.
Yeah. Wow.
Yeah.
Wow. I can see very quickly how complicated this can get internally. Potentially all of these things going on and bringing up past feelings and past thoughts. As you were talking about it, I'm aware now that there are some people who are listening who don't really know what an eating disorder is. Maybe we should have started with this, but no better time than now. Can you give just a very brief primer on, there's a lot to say about what an eating disorder is, but the difference between a diagnosable eating disorder and then the other stuff, I guess.
So I think the piece, if you're struggling, is, I call it the part of you that knows, that wise mind, that intuition, that gut sense. I think that part of you knows if you need help. It just knows.
Yep.
And it's a quiet voice, and you've usually been trying to avoid it for a long time, and it's not going away. So that would be the place I would say, if you have any concerns, if you feel that, then seek support. And in that sense, it doesn't matter if you have a fully diagnosable eating disorder or not, because support can only help.
Sure. Right.
Right?
Yeah.
Okay. So in terms of like, diagnosable versus like subclinical eating disorder versus just living in non-weight neutral health at every size diet culture that we live in.
Right. Oh my gosh, it's so complicated. Yeah. I thank you so much for bringing in that context because it's so important just to name that.
Yeah.
You may have an eating disorder, you might not, but geez, the world we live in, just, there's so much pressure. Okay. Yeah. I'll let you go.
So in terms of like DSM diagnosis, there's anorexia, there's bulimia, there's binge eating disorder, and there's, actually, I don't think EDNOS is in the DSM-5 anymore, which is funny because that's what most eating disorders are.
Not otherwise.
And then there's other ones. Yeah, thank you. And then there's other ones that probably like that are more unique to kids. So that's a whole nother podcast. So we won't go there.
Yep.
But yeah, the symptoms would be, so anorexia tends to be more towards the restricting side, although you can be anorexia binge purge type, which means your body has a level of being underweight and your behaviors tend toward restricting food, but then there's sort of two subtypes. They might just restrict, or you might restrict, and then binge, or you might restrict, and then binge and purge can be through throwing up, or it can be through overexercising. Bulimia is more either like normal eating, quote unquote, and then purging in some way, which could be throwing up. It could be fasting, and it could be overexercising, or it could be some other things that I'm not going to name specifically because I don't want to give people ideas.
Right.
But there are lots of different ways to do that. So that's bulimia. And then binge eating is, I'm trying to think if I can remember off the top of my head, the wording in the DSM. It's something to the effect of eating an amount of food larger than could be considered normal in a very short amount of time with excessive guilt afterwards.
Okay.
So, but what I would add to that is, first of all, the excessive guilt is important.
Yeah.
And second of all, everybody eats emotionally. So don't be diagnosing yourself if you had too much ice cream last night.
Right. Thank you for that.
Yeah. Because that is totally in the realm of normal eating.
Yeah, I think that's so important to note that emotional eating is part of normal eating. I learned that myself very recently, and I just was like, oh, right, okay, that makes sense. It felt like it was not good, but it makes sense that it's still within the normal realm. Yes.
I'll just throw this out here as a good resource. And I don't get anything out of this. I'm just sharing a good resource. Ellen Satter, ELL, I think it's EN, and then SATTYR. It's a good resource for moms too, because she has these guidelines for feeding your kids, which are super helpful in terms of modeling normal eating behavior and helping your kids continue to trust their hunger and satiety cues and intuitively eat and trust their bodies.
Mm-hmm.
And it's all about the division of responsibility. Like, it's different for different ages, but the kids generally usually it's the parents decide what, and the kids decide like how much. That's the sort of general guideline. But she had this, what made me think of it was she had this definition of normal eating that included most people emotionally eat.
Mm-hmm.
That's like in the realm of, if eating wasn't emotional, we'd eat food pellets,
Right.
Correct. Not the Matrix.
Right. I feel like whoever's listening, there's like a collective sigh of relief. Oh, good.
Yes.
I'm okay.
Yes. Yeah. You're okay. Right. Even if you do have an eating disorder, that's a big part of the work.
Right.
Is realizing you're okay. Like, shame is such a big piece of eating disorders.
Yeah.
And that's another, talk about like sort of triggers and what contributes to developing one. There's certain sort of like temperamental, genetic, like sensitivities that have to do with perfectionism and low tolerance for negative affect and high level of sensitivity to rejection so that's a lot of the work around recovery.
There's so much in here. I feel like we could talk forever about this, but you have put all of this into a book for people to access, specifically related to pregnancy and postpartum. Can you give us a quick sort of glimpse of what the book is about?
Sure. So it's a lot of stuff we talked about. So there's a chapter on body image. There's a chapter on food. There's a chapter on labor and delivery. There's a chapter on perinatal mood disorders. There's a chapter on how the heck do I practice spirituality when a baby is spewing poop at me.
Oh my goodness. I hope that's the actual title of the chapter.
There's a chapter on advanced maternal age. There's a chapter on going back to work. So there's a very quick overview. Okay, awesome. And so this is a recovery guide for people during pregnancy and postpartum related to eating disorders. Yes. And there are a couple topics that I missed in the book, mostly because of my own, these are not areas of expertise for me. So for example, fertility, adoption, surrogacy, miscarriage. So I'm doing a telesummit coming up with the book, and I'm going to try and get exercise and recovery. I'm going to try and get those into the telesummit. Okay. Can you tell us more about the telesummit? Sure. It'll come out in February with the book, and it's basically just going to be a whole bunch of expert interviews on these same topics. And then hopefully adding the topics that I missed in the book, like, for example, around fertility and miscarriage.
Oh, sure.
Yeah.
Okay, awesome. So I'd love for you now, if we can shift a little bit into hopeful messages, things that you've seen in terms of how people have recovered through this. I mean, people who are struggling right now, who feel like, oh my gosh, this is so much to overcome. What kind of hopeful messages do you have for them?
Okay, well, my two sort of messages of like action steps would be get support to, decrease isolation, and lower the bar on your expectation of perfectionism and achievement. So those would be my sort of two like action steps. And then in terms of hope, here's a couple metaphors that I'll throw out. One is orchids and dandelions. Have you heard this one?
No.
Okay, so orchids are basically like, as you know, probably if you know anything about plants, they're like highly sensitive plants.
Yeah.
And they have to be in the right environment to thrive.
Right.
There's nothing wrong with that. They just need to be in the right environment to thrive. And if they're not in the right environment, they're not going to thrive. Mm-hmm. Dandelions, on the other hand, you can throw them on a sidewalk and they will find the soil between the cracks and thrive. Mm-hmm. So if you are an orchid, stop pathologizing yourself about being sensitive and get yourself in the right environment. And what I mean by that is get off the losing the baby weight social media sites. Mm-hmm. Surround yourself with other new moms that are being authentic. Find other moms that have been through it that can mentor you and tell you the truth, that you're growing into your new identity and that you're going to thrive. And right now it's just about surviving, and that's okay. Which leads into the other kind of plant metaphor I have, which is, sorry, I'm forgetting the name of this plant. I have a picture of it on my Instagram feed if you want to go look it up. But anyway, it sort of looks like a cactus, but it's like flat, and it sort of looks like a rock. It's like a cactus without spikes. And so my little one bought this plant, and we've been watering it and watering it and watering it. And it's just sat there for like years. And a couple weeks ago, all of a sudden, it had a blossom. Mm. And so that's the message of hope that I have for new moms is, how they say the first 5 years for kids, like give yourself the first 5 years too.
Yeah, thank you for that. I appreciate the relatively long length of time that you're offering for people to grow into their new identity or patterns or self or whatever. For some moms who feel anxious and worried, 5 years sounds like a long time. But
yes, it doesn't have to take 5 years.
It doesn't have to take, right. Yes. right. But I appreciate that because yeah, absolutely. And everyone's in their own healing process and in their own time. Yes. And it just goes to this whole idea that you bounce back and that it is quick and it's supposed to happen in a certain time frame. But no, it happens as it needs to. And I just really appreciate you giving people that space and time to work within.
Yeah, you don't have to bounce. You can crawl.
Hey, thank you for that. Okay, well, I appreciate so much all of the work that you do and your time and the book. I'm going to be sure to have people go to your website, drlindashanti.com, so they can find out more about this, about your book and about the online summit and get connected to you to get support.
Thank you so much for hosting this podcast.
Sure. Thank you for coming on. I appreciate you.
You too.
Thank you again, Linda, for coming on and sharing this information with us. I think it's so important that we begin to understand all of the ways in which our past experience is affecting this transition into motherhood and parenthood. There's just so many things that once we understand and can kind of see the layout of how it might affect us can really, really change our experience. If you'd like to get connected with our guest today, go to drlindashanti.com and you can connect with her on Instagram, Dr. Linda Shanti, or Recovery Mama, or on Facebook at Recovery Mama. And as usual, if this is your first time with us, please do subscribe to this podcast and share it with everyone. The more people that have access to this free information and who can learn about the various ways that our paths and our mental health can be affecting us, I just think we'll be all so much better for it. Come find us on Facebook, Instagram, and Twitter, and join our Mom and Mind Connection Facebook group. Thanks so much for being with us. Until next time. Thank you so much for joining us today. Please share this podcast. Together we can support moms and families so that no one has to deal with this alone. Come connect with us at momandmind.com.